Hi, and welcome to Jam-Packed Business Made Easy. My name is Jam Anderson, and I'm the CEO of Jam AI. And today, we're practicing exactly what we teach. You're about to listen to a podcast that's truly automated with our AI hosts, who are now our new friends. We also would like to invite you to listen to our podcasts that come out every Friday, where Flora is interviewing entrepreneurs just like you. We're exploring authentic challenges and discovering practical solutions together. Speaking of community, if you're looking for a community, you can find us on the School platform. Just search for the #1 community for entrepreneurs. All right, let's dive in.
Welcome to the deep dive. Today, we're tackling a really widespread issue, burnout.
Yeah, it seems to be cropping up more and more, doesn't it, across all sorts of jobs.
It really does. And what's particularly interesting, I think, is this emerging role artificial intelligence might be starting to play in helping us address it.
Exactly. And for this deep dive, we've actually gathered insights from, well, a range of sources. We looked at articles on Medium and PMC, some explorations from Perplexity and YouTube, too, and also the views of Dr. Sharon Grossman, especially on where burnout prevention might be heading.
Okay.
Our goal today is really to, dig into how AI could potentially predict, maybe even prevent, and possibly support recovery from burnout.
And for you listening, our learner persona, we know you're keen on getting a solid grasp of things quickly. So we've tried to synthesize all this information, pull out the really compelling bits and those aha moments, without making it too overwhelming.
Yeah, absolutely. So let's dive in.
Okay, so first things first, let's make sure we're all clear on what burnout actually is.
Good starting point. Well, drawing from a PMC article, which cites the World Health Organization, it's defined as an occupational thing, basically. It comes from chronic workplace stress that hasn't been successfully managed.
Okay, unmanaged stress.
Right. And it shows up in three main ways. First, feelings of energy depletion or just emotional exhaustion. Second, increased mental distance from your job or feelings of negativity or cynicism related to it. That's often called depersonalization.
Right, like seeing people as tasks.
Kind of, yeah.
Yeah.
And third, a sense of reduced professional efficacy or accomplishment, that feeling that you're not really doing well in your work.
Got it. And the impact isn't trivial, is it?
Not at all. Dr. Grossman points this out, and the PMC article backs it up. Burnout leads to things like lower productivity, obviously, but also higher healthcare costs, and maybe unsurprisingly, higher turnover rates. People just leave.
So it hits the organization's bottom line, too, not just the individual.
Definitely. It's got real, tangible consequences.
Which brings us to AI. How does AI fit into this picture? It sounds a bit unexpected.
It does, maybe. Our Medium source calls it a groundbreaking opportunity, and Perplexity actually labels AI an unexpected ally for both burnout and general mental wellness.
An unexpected ally. Okay.
Yeah, it suggests maybe a different way to approach this whole problem.
So how can AI actually spot burnout? It can't exactly pull you aside for a chat, can it?
No, not quite like that. But what it can do is analyze huge amounts of data to find subtle patterns that humans might easily miss.
Okay, like what kind of data?
Well, the Medium article talks about looking at digital communication, the emails, chat messages. It analyzes things like response times, but also the emotional tone using natural language processing.
NLP, right, so it can understand the sentiment in the text.
Exactly. It's trying to pick up on shifts, maybe increased negativity or shorter, more abrupt messages over time.
Interesting. So if my emails get really terse all of a sudden?
That could be a flag, yeah. But it's not just text. AI could also potentially analyze biometric data if people consent, and it's available, of course. Things like heart rate variability, sleep patterns, and also workplace behavior, like how much time you're spending on certain tasks, how often you take breaks. The Medium piece mentions this, and Perplexity reinforces it, monitoring stress indicators and work patterns for early warnings.
And Dr. Grossman brought up analyzing speech and text too, right? Looking for things like negativity, maybe less engagement, signs of strain.
Yes, precisely. Increased strain, exhaustion cues in language. And she mentioned something quite futuristic sounding, analyzing microexpressions.
Microexpressions, those super brief facial flickers.
Yeah. The idea is that AI could potentially detect those fleeting signs of distress or fatigue, things we might not even consciously notice in ourselves or others. Very early glimpses, maybe.
Wow, okay. That's quite detailed. So AI can detect these signs. How does that help prevent burnout from actually happening?
Well, this detection capability feeds directly into prevention strategies. The Medium article talks about continuous monitoring, tracking response times, communication flow, workload balance across teams.
So seeing trends over time, like if someone's constantly working late or their communication drops off.
Exactly. And that data fuels predictive analytics. AI identifies deviations from someone's baseline behavior, maybe a surge in late-night emails plus a dip in reported progress. That could trigger an alert, maybe assign a sort of burnout risk score.
Risk score. And then what? Just a warning light flashes somewhere.
Hopefully something more helpful.
Yeah.
The aim is personalized interventions. Based on that data, the AI might suggest taking a specific type of break, maybe flag a manager about workload distribution, or even recommend specific resources like counseling services. Media mentions integrating with wellness programs, too, suggesting tailored exercises or mindfulness practices based on what the AI is seeing.
It reminds me of how Dr. Grossman put it, AI as a compassionate guardian of boundaries.
That's a nice way to phrase it. It could gently remind people about the need for rest, for stepping away.
Okay.
And beyond the individual, AI can help with workload management for the whole team. Both Medium and Perplexity mention this analyzing task complexity, matching it to skills, helping distribute work more fairly so maybe one person isn't always getting overloaded.
That could be a huge deal in some workplaces, a real potential game changer for fairness.
Definitely. It tackles one of the root causes.
What else can AI do on the prevention front?
Automating tedious tasks is a big one. Perplexity and the PMC article both highlight this. Think about handling documentation, scheduling meetings, maybe even aspects of billing.
The admin burden.
Exactly. Freeing up time, especially for professionals like doctors or therapists, lets them focus on the core parts of their job. Or, frankly, just gives them breathing room for self-care.
The PMC article mentioned digital scribes, didn't it?
Yes, that's a great example. AI listening in, say, during a doctor-patient visit, and automatically drafting the notes. That could save a massive amount of time. Perplexity also touched on AI providing real-time assistance during therapy, maybe suggesting interventions based on the conversation, or summarizing key points for the therapist, again, reducing that cognitive load.
And even smaller things, like the PMC article notes using AI to help manage your email inbox, categorizing, prioritizing, maybe drafting simple replies. Every little bit helps reduce that feeling of being overwhelmed.
So it's attacking the workload from multiple angles. Now, what about AI chatbots? They seem to be everywhere. How do they fit in?
They offer a really accessible support channel. Perplexity points out they can provide 247 personalized support, things like self-care tips, maybe psychoeducation about stress and coping mechanisms.
And available anytime. That could be crucial for someone struggling late at night.
Right. That constant availability might help prevent things escalating into a full-blown crisis. Plus, there's the anonymity factor.
Yeah. Perplexity mentioned that too. Less stigma, maybe. People might feel safer talking to a bot initially.
That's the idea. It could lower the barrier to seeking some form of help. And one of the YouTube sources we looked at discussed how these chatbots can even simulate empathy and offer basic advice.
Simulate empathy. It's important to stress the simulate part, I guess. Absolutely. We need to be realistic about their limitations, but they can still be a useful, readily available first step or supplementary tool.
Okay, so AI for detection, for prevention. What about when someone is already burned out? Can AI help with recovery?
Yes, Dr. Grossman outlined a few ways here too. One is using that same behavioral pattern recognition, but for recovery.
How so?
By tracking work hours and productivity during recovery, AI could offer guidance on, say, recalibrating workload gradually, finding a sustainable rhythm again. It's like a data-informed coach for getting back on track.
Okay, helping to rebuild healthier habits.
Exactly. And just like in prevention, those AI chatbots can offer ongoing emotional support during what can be a tough recovery period. Both Dr. Grossman and the YouTube source pointed to that.
Right.
Plus, AI could recommend personalized resources, not just generic advice, but specific articles, maybe online courses on mindfulness or stress management, even potentially curated lists of therapists specializing in burnout, all tailored to the individual situation.
That sounds incredibly useful, a personalized support toolkit, almost.
Yeah.
So if we zoom out, what are the big picture benefits organizations might see from using AI this way?
The Medium article summed it up nicely. You're looking at potentially enhanced employee well-being, which is huge.
The primary goal, really.
Right. Then, consequently, increased productivity and efficiency because people aren't running on empty. Reduced turnover rates, which saves money and retains knowledge.
Makes sense.
It also enables more data-driven decision-making for managers. They get insights into team stress levels or workload issues they might not see otherwise. This can lead to improvements in the overall organizational culture, making it healthier.
And ultimately, financial savings from all those factors combined.
Exactly. Reduced costs, improved output. The potential business case is strong.
There's always a but, isn't there? Can't all be smooth sailing. What are the catches, the limitations?
Absolutely crucial to discuss. And yes, there are definitely complexities. The Medium article makes a key point. AI systems are only as good as the data they're trained on.
Meaning bias is a risk.
A huge risk.
Yeah.
If the training data is biased, the AI's predictions or recommendations could be inaccurate or worse, discriminatory. And let's be real, AI, for all its sophistication, doesn't understand human emotion or context in a deep way. Our YouTube source touched on this, that lack of genuine empathy.
So it might misinterpret situations, false positives or negatives.
Potentially, yes. It might flag someone as stressed when they're just having an intense but productive week, or miss someone who's quietly struggling. Context is hard for machines.
There are ethical concerns too, right?
Privacy.
Big ones. We're talking about collecting and analyzing potentially sensitive employee data communication patterns, maybe even biometrics. Medium and Perplexity both flag data privacy and accuracy as major ethical hurdles.
Yeah, that needs careful handling.
And Perplexity brought up an almost ironic point. The stress of adopting these new AI systems, learning new tools, worrying about being monitored, it could actually increase stress initially.
Right, if the tool meant to help ends up being another burden. Exactly.
Okay.
Which ties into another point from Perplexity, the importance of self-efficacy. People need to feel confident and capable using these tools for them to be helpful, not harmful.
And we touched on this with chatbots, but it bears repeating. They are not a substitute for human connection or professional help in a crisis.
Absolutely critical. That was clear across multiple sources. They're a tool, not a replacement therapist.
The PMC article also raised some specific concerns, particularly for healthcare. De-skilling was one.
Yes. The worry that if professionals rely too heavily on AI for things like diagnosis or summarizing notes, their own critical thinking skills might atrophy over time.
A valid concern.
And it also mentioned the changing cognitive demands. If AI handles routine stuff, professionals might end up only dealing with the most complex, draining cases, which could paradoxically increase burnout risk in a different way.
Interesting point.
Plus, the potential for technology to create more distance, that feeling of alienation between patients and providers or employees and management, and crucially, equity concerns.
How so?
If AI tools are implemented unevenly or require expensive infrastructure, it could actually widen existing health disparities rather than closing them. Access becomes an issue.
Okay, so a lot of potential pitfalls. Given all that, what can be done? Are there ways to mitigate these risks?
Thankfully, yes. The PMC article offered several strategies. One big one is continuous education, making sure people understand how AI works, its limitations, how to use it effectively.
Training is key.
Definitely. And vigilant human oversight. AI should be a co-pilot, not the pilot. Humans need to stay in the loop, validate outputs, use their judgment.
Makes sense. Don't just trust it blindly.
Exactly. Transparency is also vital, being open about how these systems work, and involving the actual users, the employees or clinicians, in the design and implementation process helps ensure the tools are actually useful and not just another top-down mandate.
So they feel ownership and understand it better.
Right. The goal should always be to supplement human capabilities, not replace them. And alongside all this, we need strong regulatory oversight and ongoing efforts to find and correct biases in the AI models and the data they use.
It sounds like a constant process of refinement and vigilance is needed.
It really does. It's about finding that careful balance, using AI's power responsibly, while keeping human well-being and ethics front and center.
Okay, so let's try and wrap up this deep dive. It seems pretty clear that AI holds, well, significant promise for tackling burnout.
Yeah, the potential is there, analyzing data for early signs, automating draining tasks, offering personalized support for prevention and recovery.
But, and it's a big but, we have to be realistic. There are limitations, serious ethical considerations, potential risks around data, bias, and the irreplaceable value of human connection.
Absolutely. A balanced approach is crucial. Human oversight, transparency, ethical guidelines, they're not optional extras, they're essential.
So, this leaves us with a final thought for you, our listener. As AI becomes more woven into the fabric of our work lives, how might it reshape our very understanding of work-life balance?
Mhm.
And what will a truly supportive, healthy work environment even look like in, say, 5 or 10 years with these tools in play? It
Mhm.
really prompts reflection on the long-term dance between technology and human well-being.
It's a huge question. This deep dive really is just a starting point for understanding what's a very complex and fast-moving field. Hopefully, it's given you some food for thought.
We hope so too. Keep exploring, keep thinking critically about AI's role in our work and lives.